Now, the test and trace scheme in England has had its worst performing week since the beginning of July when it comes to reaching the contacts of those infected in the community. The tracing team only reached 58% of contacts of those testing positive in the week ending the 7th of October. Our health editor Hugh Pym has been looking at why the system is still struggling to deliver.
Could this be the future for mass testing of the population? Children arriving at school in Southampton drop off saliva samples which are tested for coronavirus. It's easy for them to do with quick results and is now part of a trial to assess the potential.
We know we can turn around those results within 24 to 48 hours. So it's a great opportunity not just to keep children and teachers within school settings, but also more broadly to other businesses and settings too.
That's the aim, but right now the system for testing using swabs and following up contacts in England is under strain. Ministers say capacity is being increased up 10% in a week, but some say it's not working efficiently.
And a lot of the calls were essentially repeat calls.
Martin's family are self-isolating after 2 tested positive, but they were surprised to get dozens of calls from test and trace staff.
We probably needed 4 or 5 phone calls to tell us what our end date was and how we were doing, but that's it. And so the other 32 phone calls could have been given to other families.
In the first week in October, the number of results back in 24 hours for people going to testing centres in England was 32.6%, slightly better than the week before, but much lower than in June. Just 57.6% of close contacts of those testing positive in the community were reached and asked to self-isolate, down from 62.5% the previous week. Senior health officials say testing and tracing gets more and more difficult as case numbers accelerate across the population, and it's really most effective when infection rates are lower than they are now, and local outbreaks can be quickly identified and tackled.
The sorts of restrictions that we're seeing coming in, of course they are to save lives, but they're also to reduce the number of cases in circulation so that it comes down to a manageable level so that the test and trace system is able to work so effectively that it will be able to find a much higher proportion of the people who are at risk.
In Spain, the testing system may be working, but tracing said to be very patchy. In Berlin, long queues have built up outside testing centres. Test and trace problems are not just limited to parts of the UK. Hugh Pym, BBC News.
People who've been working at one coronavirus testing laboratory have told a joint investigation by the BBC and the online newspaper The Independent of their concerns about safety standards. One scientist who worked at the Milton Keynes Lighthouse Lab claimed that staff were being put at risk. The health and safety executive has found breaches in safety following the claims. The company which runs the laboratory says it does have strict safety measures in place, and the government said tonight it regularly reviews and inspects the labs that it uses. Our health correspondent Sophie Hutchinson has the story.
The Lighthouse Labs, sometimes called mega labs, mass processing centres for coronavirus swab tests. The government had them set up in order to dramatically increase testing during the pandemic. One of the first to open was this lab in Milton Keynes, where hundreds of staff process around 40,000 tests a day. But some of those who've worked here have told us of safety concerns, which they fear are putting staff at risk.
It's just chaotic, it's dangerous.
Julian Harris, a virologist, worked at the lab this summer. He believes cracks in the system began to show when the calibre of staff changed.
When the lab started in March, then they had furloughed academics, virologists, biologists, all these people. So they had the experience, right? But towards the middle of June onwards, they started to go back. And then you got an influx of these really young people with absolutely no experience.
He alleges the training for new recruits was completely inadequate.
These people, no lab induction for a biosafety level 2, and then they're just launched into this facility. And it freaked me out.
The work is carried out in protective cabinets like this, which remove infected air. But Dr. Harris claims in order to get as many tests done as possible, cabinets designed for one person were being used by 2, a practice other scientists have told us is at best poor and at worst dangerous. And he says the cabinets were being overloaded with piles of plastic bags from swab tests.
the whole dynamics of the airflow in the cabinet is corrupted, and what you get turbulence. You might as well be working on an open bench. These young people don't realise that they're being put at risk.
Another scientist who wanted to remain anonymous told us he resigned from the Milton Keynes lab because of safety concerns.
We had disposable visitors' lab coats with gloves taped to the sleeves with brown parcel tape to reach into cabinets. I know it can be permissible in developing world labs, but operating that way in Milton Keynes was just inviting litigation and ridicule.
The UK Biocentre, which runs the lab, said safety was their #1 priority. It said we have strict safety measures in place to protect staff who are operating in a confined laboratory space. It said training was robust, recruits have lab experience, cabinets were operated by just one person with a second person observing, and that there was a choice of PPE, including cotton lab coats.
We believe everyone has the right to come home safe and well from their job.
But the health and safety executive has visited the lab. It told us it found 5 material breaches. We understand they relate to social distancing, cleaning regimes and site safety training. The lab said it had already reinforced its processes based on the HSE's recommendations. The government's target is to increase testing capacity by 1/3 by the end of the month in an attempt to get a handle on the pandemic. Ensuring it can scale up safely has never been more important. Sophie Hutchinson, BBC News.